It's now time for the Weekly with News 6 Morning anchor Justin Warmoth.
This is the Weekly on clickorlando.com with Justin Warmoth.
Good morning, I'm Justin Warmoth. Health officials say the coronavirus pandemic has created the greatest mental health, substance abuse, and overdose crisis in U.S. history, and the numbers are staggering. According to the CDC, there were nearly 94,000 overdose deaths in 2020, a 29% jump year over year. And Florida's increase was much worse than the national average and among the highest in the nation. This morning, Seminole County Sheriff Dennis Lima is here to break down what's fueling the crisis and what's being done to reverse course.
Let's just get right into it. First off, can you recap how bad of a year 2020 was when it comes to the opioid crisis?
Yeah, so I think that prior to COVID-19, we had a huge problem across our country, and especially here in the state of Florida, when we were kind of one of the last states to create a prescription pill monitoring system. The overflow of opioids that were available in our community, and we had a record year just before COVID-19 happened. But this year, it's even been worse as people have really lost their jobs and really had personal stress and concern with their own personal health and well-being of their family members. We've seen a spike in overdoses here in Seminole County and across the state. To put it in perspective, from January 1st of this year, we've had 530 overdoses and unfortunately 71 overdose deaths. And that's a 25% increase respectively in both categories.
Mm-hmm. A few years ago, we were seeing prescription opioids fueling the majority of the overdoses, but that's not the case anymore, correct?
Yeah, that's not the case. With the prescription, we talk a lot about Purdue Pharmaceutical and the Sackler family and the overprescribing of opioids. That's what created an unprecedented dependency across the country and here in the state of Florida. But what has occurred now is people have turned to synthetic opioids, which are much stronger and powerful than the pharmaceutical grade, properly processed drugs that people were taking before. Mm-hmm. To give you an example of fentanyl is 100 times more potent than morphine and 50 times more potent than heroin. And we're seeing fentanyl mixed in all types of substances, from marijuana and some cases tobacco. And a lot of people who are taking these drugs are not realizing that they're taking the heavier dosed, made in clandestine labs of fentanyl, and they're nearly dying immediately upon taking the drug.
Where is that fentanyl coming from?
Well, it's being processed in labs, around the world. It first started in China with rogue chemists processing it, and they would move it into easier access points to get into the United States. First other countries other than Mexico, but a lot of it is coming now across the Mexican border. People in Mexico now are processing it. People are carrying it across the border, and in some cases they're mailing it into the United States, which makes it an incredibly difficult process to track and easy for the user who is already dependent on the drug to get it without having to put themselves in this perceived harm's way. It's a very intrusive process to go out there and meet a drug dealer on the street and have to concern yourself about getting robbed. So what people have done is they've had these drugs mailed to them in a very similar way as people purchase things from Amazon.
But they're not buying fentanyl, what they believe is fentanyl. They're buying drugs, cocaine, marijuana, as you mentioned, other opioids, not knowing. I mean, it's unbeknownst to them that these are laced with fentanyl, right? I mean, can you take us through that?
So to take a rather complicated situation and make it very easy to understand is if somebody has been on an Oxycontin regimen for 5 or 6 years, they've been taking pharmaceutical grade Oxycontin, that's been their pill of choice. Their primary care physician has now realized that this is not healthy, that this drug is very, very addictive. We need to weed you off of that. Sometimes people have gone to the internet and said, look, I need 80 milligram Oxycontin. And they see what appears to be the exact same drug that they've taken for 5 or 6 years safely, although they've been addicted to it. They haven't been overdosing, not realizing that the drug is made in a clandestine lab, which is a fancy way to say somebody's bathroom, and processed with the more powerful synthetic opioid, fentanyl, or in some cases carfentanil, which is 100 times more potent than fentanyl itself, much cheaper, but it's pressed with the use of pill presses to look exactly like the drug that they've taken. So you can imagine if somebody's taken a drug for 5 or 6 years, it comes marketed as an 80 milligram Oxycontin, something that they're very familiar with. The moment that they put it in their mouth, they overdose because it's simply not what they're accustomed to taking.
Who is this affecting? Who is really being affected by the current opioid crisis?
I think all of society is affected by this. We know that that 1 out of every 3 people have a personal story with somebody that they care about deeply, struggling with some type of dependency and addiction. And what we're seeing now is the need for co-occurring support and help. You cannot be addicted to a substance without also suffering some mental health conditions that go along with it. And really, to take a very difficult topic, there's a middle part of the brain called the amygdala. And when our brains work properly, the amygdala sends signals to the frontal cortex of our brain. Well, when somebody takes a drug, especially if they're addicted to a substance, it affects the amygdala. So when we have rational thought occurs in the frontal cortex of our brain. So quite literally, people who are dependent on drugs are not thinking in the right frame of mind. And this is why we see loved ones selling off their heirlooms for drugs, abandoning their families, and addicted to a substance. A medical doctor that we work with quite frequently said, if you ever wanted to know what it feels like to be addicted to opioids, have somebody hold you underwater for 60 seconds and then let you go. That fight that you have for the surface for air is the same fight that somebody's addicted to this drug.
And I think that's probably why Project Opioid is such an important initiative, because you're getting, explain what this is, because I think it's so important to get this across, that you have business leaders, faith leaders, just community leaders who are involved. Why is that such an important piece in fixing this crisis?
So Andre Bailey, who's the founder and CEO of Project Opioid, came together with executive team of members of Florida Blue. And they said, we cannot fix this problem through government. You definitely cannot arrest your way out of this problem, which is something that law enforcement executives have now said for many, many years. It's not until all segments of our community come together, our faith-based, our business, and then our government, to include law enforcement, to address this. Although these numbers are staggering, when you look at 530 overdoses in Seminole County alone, 71 overdose deaths, a very affluent county. These numbers are just a reflection of how many people within our region are dependent on a substance. Justin, we did some research with Project Opioid prior to COVID-19, and we determined that there were more than 60,000 Central Florida residents who are dependent on a substance, but not falling into the statistical categories that we're tracking right now. So we have an unprecedented demand. COVID-19 even turned more people towards the substance of choice. And the strategy that Project Opioid offers is to pull the public and private sector together. We know that many people who are taking these drugs actually go to work every day, and making sure that our private sector, our public sector knows what to look for and what resources to provide the person and their family is key to our overall success with combating this.
And Sheriff Lima says the social stigma surrounding addiction is also costing people their lives. Coming up, his message to those who might be too ashamed to get the help they need. We'll be right back.
This is The Weekly on ClickOrlando.com with Justin Warmoth.
Welcome back. Our topic this morning, the epidemic within the pandemic. The opioid crisis reaching historic levels over the last 18 months as the coronavirus causes uncertainty and hardship and ties up the resources people need for treatment. Our guest this morning, Seminole County Sheriff Dennis Lima, is one of the main players working to address the rise in opioid deaths.
Can you take me through some of the actionable items that you guys have discussed that you believe will make a true difference?
Yeah, I think that first, putting my law enforcement hat on, we have to hold drug dealers accountable. And here in Seminole County, I think we've charged more than 30 people with first-degree murder for dealing deadly doses of narcotics. We're also leading the charge here in Central Florida with advocating for new laws that would help hold those people accountable, and at the same time, make sure that the people who are trying to get clean are protected. One of those legislative priorities is to be able to increase the charging ability for drug dealers selling drugs in proximity to a drug treatment facility. Right now, we have an enhanced penalty if a drug dealer is selling drugs close to a school or a church or a playground, but no enhanced penalties if they're selling drugs in proximity to an area where somebody is trying to get clean. That's something that seems like it would be an easy fix. Additionally, we want to make sure that we can get Narcan in the hands of as many people as we possibly can get. And that's just not public safety professionals, that's private citizens as well. And we've modified the law under the leadership of some great Central Floridians. David Siegel was a great ambassador after losing his daughter Victoria to this horrible disease, to make sure that Narcan is accessible to people, because quite literally, Justin, it saves lives. In Seminole County alone, we deploy probably 800 or 900 doses of Narcan per year. And put that in perspective, that means we're bringing 800 people back to life. So there's a lot of things that we're doing to increase awareness, to make sure that people get the help that they need, while at the same time holding the drug dealers accountable, so they're not going out there and pushing this drug out on the streets.
So getting Narcan on the same level as like an AED. You see a lot of AEDs in businesses all over the place. It seems like if you find a place of business, there's an AED there just in case. Is that the level that you'd like it?
Absolutely. That's one of the things that we talked about is to have the standard that you would have access to Narcan at every school, every business, every private sector. And what's interesting, there's a lot of confusion about the greatest benefit of deploying Narcan. And I will tell you, Justin, it's not giving a dose of Narcan to the person who's on the journey themselves. If you take that hot dose of a drug and go completely out, you cannot deploy the Narcan on yourself. You're going to be unconscious. So, it's completely safe to use. I mean, there's very little training that goes along with it. I mean, you put it in somebody's nostril, and what happens is when somebody takes a drug, that opioid attaches to an area of the brain called the mu receptor of the brain. And it says, relax, relax, shut down, calm down. You know what? You've been breathing a long time. Just stop breathing. And if you're not going to be breathing, we can turn your heart off. Literally, it happens that quickly. So Narcan attaches to those same mu receptors in the brain and basically says, time out, don't turn off. If you turn off, you're going to die, and gives a patient 90 minutes of life. If they get to the hospital and get stabilized within the first 90 minutes, it's very likely that they will survive. If they take Narcan and they don't get to the hospital and they've taken a hot and heavy dose, it's very likely that they'll go back into those same withdrawals and overdosing again after that 90 minutes is up. So very easy to use. Project Opioid, we're giving these Narcans out to anybody who needs it. And I encourage people to go to the Project Opioid website or contact us here at the Seminole County Sheriff's Office. We'll guide people in the direction to get them the help that they need.
Another facet of this seems to be the stigma surrounding addiction. Seems to be costing people their lives, unfortunately. So what would be your message to someone who has an addiction but is too ashamed to reach out and get the help they need?
Every time we speak about this, we're left with the question of, you've convinced me, tell me what I can do now to help. And one of the things that I always say immediately is, you can help us change the face of addiction. This is not a situation of trying to make bad people good, but rather sick people well. We know that more than 80% of the people who were introduced to an opioid were introduced to it by somebody that they trusted. Largely their physician at the time, where they thought it was safe to use. And that's how they started down the path. And I think that there's this stereotype that every person who's addicted to a substance is homeless and living under an overpass somewhere. But this affects all demographics. Actually, the largest increase that we've had in the past 12 months is in communities of color. African American, largely Hispanic communities had 110% increase in overdoses within the area. So there's also something that I think is important when it comes to addressing this. It's called the Good Samaritan law. And a lot of people don't realize that if they are with somebody who is overdosing, even if they've used drugs illegally themselves, if they call 911, they would get immediate attention and not suffer penalties or consequences for making that report. It kind of goes into the lane of saving somebody's life is more important than criminal prosecution. That's what we want to encourage people to do. We've had somebody here in Seminole County dropped off unconscious at the hospital and unfortunately died because of the fears, I'm convinced, the fears of being apprehended for calling 911.
Yep. I know that you know this, and I think it's imperative that awareness is boosted. And it's tough with the pandemic, a lot of resources tied up on our end, on your end, on the hospital's end. But I do want to bring up the International Overdose Awareness Day event that is happening in Seminole County. You will be there as a guest speaker. What would you tell someone who's, this is going to be happening Saturday, August 28th, 10 a.m. at Ryder Park in Longwood. The messaging behind why you guys are doing this and why should someone come out to this?
So we want to encourage as many people to come out. It's an outdoor event. People will be able to socially distance with COVID, but it is incredibly important for us to show our society and families who are struggling with this that they're not alone. This process breaks the stereotype and the fear that society would stereotype or point a finger at them. There'll be a lot of family members that have lost a loved one and have made it their point to serve as ambassadors of the message so other families don't have to go through what they've been through. But I'll tell you, Justin, when the smoke clears and hopefully, God willing, we're able to get through this COVID pandemic, we will be stuck with addressing the crisis within a crisis. And this is an unprecedented overdose epidemic, the co-occurring challenges of mental health. It is incredibly important that our society comes out and supports those people who are most vulnerable and needs the help the most. One of the fundamental principles of our society, I feel, is to preserve health and life in our communities. And this overdose awareness event will do just that. There's a long road ahead, but this is a wonderful start increasing awareness.
And again, that overdose awareness event will be held next Saturday, August 28th from 10 a.m. until noon at Ryder Park in Longwood. A big thank you to Sheriff Lima for his time this week. For more information on the opioid crisis, just head to clickorlando.com/weekly. I'm Justin Wormuth. Hope you have a great Sunday.